Welcome back to DermDocs, everyone. Today we have the pleasure of speaking with Dr. Jason Emer, and he's going to share the secrets to redefining perfection with us. Dr. Emer is well known throughout the nation as the master of his field. He is redefining the world of liposuction and body shaping, one impeccably sculpted client at a time. Dr. Emer pushes the boundaries of what's possible, earning him a well-deserved reputation as the man behind some of Beverly Hills' most notorious bodies. This is a must-listen episode, and if you haven't already, don't forget to rate, subscribe, and follow DermDocs, and leave us a 5-star review. Thanks, everyone, and enjoy this episode. Welcome, Dr. Emer. It's such a pleasure to have you on the podcast today.
Thank you so much. I'm excited to be here, you guys.
Well, we're really happy you're excited as well. So, because June is Men's Health Month, LiVDerm is featuring some topics that pertain specifically to men. And you specialize in both surgical and non-surgical methods to reshape the nose. How do these services relate specifically to your male patients? And have you seen an increase in demand from male patients in recent years?
Well, as you guys know, when I first started in Beverly Hills, I moved here from San Francisco. It'll be 8 years actually in August. I was a young male dermatologist. There wasn't that many male dermatologists treating patients here. So I said, how am I going to stand out? And it was actually presenting myself as the male dermatologist to go to for male facial and body contouring. And so at that time, which now it seems very commonplace for men to get things like jawline, cheek, chin, sort of facial enhancement or augmentation, we call it male facial sculpting with fillers. I started doing videos and it started getting really popular. And so 60% of my practice is actually male facial rejuvenation and body rejuvenation. And that kind of stimulated into, as the years have gone by, so many more males coming in, not only for sort of contouring or feature enhancement, but also skin care, prevention of skin sagging like laxity, and doing the overall full treatment plans that I feel like many of our women were always doing for preventative treatments. Men are increasingly more commonly coming in. And it's not just men that you would assume, care about their looks, like let's say the gay population or those in entertainment or on TV. It's everybody. They all want to feel and look better. You know, in your early 20s, you start to notice some dark circles and things starting to, like wrinkles starting to form around the eyes. In the 30s, you start to notice some laxity and volume loss in the face. The lip volume starts to go down. And so many men, their nose tends to be the focal point of their face, especially because most men have a little more broad of a nose, a little more curved of a nose. It tends to be more masculine to have that larger, more thick nose. They tend to want it a little more slender, a little more balanced to their face, so they don't appear to be, unapproachable. They appear to be like too masculine. Guys that have a little bit of these feminine features now tend to be a little more approachable by women and by men. And so that started stimulating guys coming in looking for non-surgical options. That obviously men were a little more scared of surgery, I would say 8 years ago. Now I feel like it's a little more commonplace. So we're doing a significant number of non-surgical augmentation on the nose with fillers, specifically on the dorsal part of the nose to camouflage bumps, and also the tip of the nose to give a little bit of elevation in the nose and make it more balanced to the rest of the face. But I very rarely will do just a nose. We're doing full facial contouring. We're doing we call it harmonious balancing or dynamic filling, where you look at the person's face and you see where do they need their features enhanced at their age. Is it jawline, chin, cheeks, temple hollowing? Are we balancing out the nose so it fits their cheeks? Lips tend to be an undertreated area in guys, but guys tend to lose a lot of volume. And if they have beards, like it's a trend right now, they have less lip volume. So it is a huge trend right now, especially in my practice. I have men coming in with their significant others, their girlfriends, their boyfriends, at the same time getting treatments together because they're so into it. I have so many men coming in for monthly facials. They're following my skincare routines, my Emer Skin Aerify routine, which is a kit they do every 2 weeks. And they're really getting into this preventative aging. They want to prevent the sagging process by doing energy-based devices, like things like Pixelate for microneedling radiofrequency for tightening, and lasers on the surface of the skin, like less downtime lasers like let's say Moxie, for example, by Cyton, which is a great sort of 2 to 3 day light peel, making their skin look amazing with very minimal risk. So like I said, if you haven't been treating males, it's really important because so many want it, but it does require a very, very specific aesthetic eye, and you cannot treat the males the same as females.
Wow, thank you. So many options, especially for males. That's wonderful. So as you know, South Beach Symposium is expanding our reach to the West Coast for a first time ever conference, October 14th through 16th. So what do you think some of the prominent dermatologists in California can express to the audience there, just from a West Coast standpoint?
Well, listen, we're not going to get back into, East Coast versus West Coast when it comes to music in terms of that dynamic. But I will say that I treat patients in Boca, Florida, New York, Manhattan, and also LA. And there is a different vibe in each area. I tend to have a very sort of natural, enhanced aesthetic look. It's not overdone. So all the clients in those areas tend to want the same things when it comes to my treatments. But I will say on the West Coast, there's a little bit more of that sort of willing to push the limit. Some people are in entertainment. I have a lot of drag performers and trans patients. I have a lot of people that are a little more out there with regards to their social media and their entertainment. So they're willing to get bigger lips. They're willing to have more lateral contour to their cheek that makes it pop when they're wearing makeup. They're willing to look a little bit more overdone and push the limit when it comes to filler injections with lasers. I find that people are wanting to do more bigger treatments less frequently rather than smaller treatments more frequently on the West Coast. Whereas on the East Coast, my New Yorkers, they want to come in every month or two and do something light. They want to do little bits just to have little bits of enhancement. So I feel like because I'm a dermatologist in a very prominent area with celebrities, entertainment, I'm willing to do these big combination procedures, multiple lasers at once, threads, fillers, all at one time, because my patients want to do the big bang for their buck. But they're also willing to have a little bit more noticeability. They want people to know they have that high cheekbone from filler. They don't mind having that Russian lip that stands out. And sometimes we push the limit a little bit, but again, my aesthetic tends to bring in the patients that want a little bit more natural of a look, more preventative, and what people don't really know was done. I was watching Netflix actually the other day, and I took a picture of a guy. I sent it to my manager, and I'm like, wow, his jawline is so perfect. That's the type of jawline that I need to be creating, when I'm treating someone, because it doesn't look done. It just looks perfect. And he goes, Jason, that's your client. So I had no idea that I even remember treating that client on his jawline because it was so natural, but it would definitely look too perfect. So it's one of those things where my patients are willing to push the limit, but they still want to look natural. And I think we can bring that, especially I'm going to bring that combination approach, that bigger bang for your buck treatments to SBS on the East and on the West. And I think it's going to be, really great to be able to work with other dermatologists to see what they're doing. I know that, I'm allowed to be a lot more innovative and progressive here. So my patients are willing to take the risk. In some areas, I know some dermatologists aren't. So I think there's going to be a lot of learning from the things I'll be able to present.
Wow, well, that's amazing. And it's also so funny that you didn't even realize that was your patient on Netflix.
I know. I mean, that happens
funny.
to me so frequently because I treat everybody the same. I don't change my pricing for anyone. It's all the same. And so, when I'm doing treatment, to me, it's about artistry and about, the long-term development of a relationship with the patient and watching them as they age, keeping them looking as good as they can and as young as they can for that age. I don't even really notice what people do until I'm told by my staff or I see it on TV.
That's so funny. Can you please give our listeners a glimpse into plasma pen treatments for non-surgical skin rejuvenation and explain why patients have been so enthusiastic about these treatments?
Well, the interesting thing is, there's a lot of sort of, conspiracy theories, or there's a lot of hype on social media about plasma pen. I think because it looks really cool. It's a little pen that creates all those dots. Specifically, we use it in areas of thinner skin, like around the eyes, fine wrinkles around the mouth. neck area, elbows and knees. I've done it for combination for acne scars. We've used it for wrinkles on the forehead. Each of these little dots peels, and over the course of 3 to 5 days, it will peel, developing a little pink spot. That pink spot will fill in with collagen. So you get a lot of tightening with minimal downtime compared to lasers like I do on the eyes and mouth for aggressive CO2 lasers, or let's say contour erbium treatment from Cyton. Amazing results, but 2 to 3 weeks of downtime. So I think a lot of people not only are excited about what it looks like on social media because it's attractive and it's like, Dr. Pimple Popper, you just want to keep watching it, but it gives an amazing result. It just takes more treatments. It's more of a less invasive treatment for tightening and for improvement of fine wrinkles. The issue with it is with the improper training, with the wrong device, and with not having adequate pre and post skincare protocols. I've actually developed protocols with my own skincare line, Emer Skin, specifically to help it heal faster, to prevent hyperpigmentation. We use peptides, retinols. I have a non-bleach lightening serum and also a weekly mask called Aerify that people use, and it gets an amazing outcome. But if you don't do that, some of the consequences can be devastating. There could be prolonged red dots, or we call post-inflammatory erythema. You can have hyperpigmentation or hypopigmentation. You can get streaking, and you can also get irregular texture, what we call chicken skin. So even though it's an amazing new progressive technology, it's really important you're trained properly in how to use it, how to take care of the patients that get it done. We're combining it with lasers. We find that the results are even better, specifically in those that want less downtime with the Moxie laser from Cyton, like I said, for very minimal downtime. Of a lot of red carpet patients that do interviewing on the red carpet, they use this and are in front of 4K cameras and their skin looks unbelievable. For those that want more aggressive approaches, we can combine with ablative lasers or even a halo hybrid fractional laser to get amazing outcomes. But skincare is super important. And this technology in the right hands can give amazing results. I know many doctors I see on social saying, don't do this treatment. The issue is they haven't done it enough. When you've done so many treatments like we have, we're doing probably 10 to 15 every day because I'm combining it with every laser that I do. You get really good at understanding how to use it. It's all about understanding and using it properly. So I think that this right now is the most hyped new treatment, but there's other treatments that are going to be coming up in 2022 for tightening that I think will be what really paves the way for what we're looking for non-surgical, which is the prevention of sagging. Because right now, very difficult to get. And although people are posting things like doing the jowl area with plasma pen and full faces, it does not get the tightening that you would think. This is for texture, not tightening, except for around the eyes. So we will see what's upcoming in the near future, but I think that's the wave. Right now, we're over flooded with lasers. We can get any result with the lasers we have on the market for almost every skin type that's there. But for tightening, we're limited. So that's where the future is going to be.
Well, there's a lot to look forward to for sure.
Tons.
So how about chemical peel treatments? How can they enhance the results of injectables like fillers and Botox?
Well, here's the thing. Anything you do on the surface is going to make you look younger. I just did a Access Hollywood a segment using skincare and a combination of BBL by Cyton and Moxie by Cyton. And just the skincare alone for 2 weeks prior to treatment decreased the age by 3 years on infrared. When we combine the two, the laser and light treatment, which is what we call a Titan Bright or Hollywood Spotlight treatment, that decreased the age another 7 years. So it combined make 10 years. So combination therapies always make people look way younger. Does chemical peels or skincare affect Botox? No. Does chemicals peels or skincare affect filler? No, because they're treating something different. Botox is the movement lines. That's on the muscle. And filler is on the bone or in the tissue, giving contour and filling folds. So they're not really going to together enhance each other. But overall, when you use them as a part of a treatment plan, using the chemical peels, lasers, and skincare for texture and tone, doing the fillers for your volume and for contour, like facial sculpting, and also the Botox for movement lines, overall, you're going to look more youthful. So it's really important to do it all. When someone comes in and says, what should I do first? I say, you got to do it all, because that's what's going to be prevention of aging. It's just like going to the gym. If you go to the gym and you don't eat right, do supplements, sleep, drink water, do all the things that you need to do, you're not going to get the best result. But if you do all of that, your body looks way better and you feel better. Same thing about the face. You have to address all 8 areas of aging: the laxity, the volume, the texture, color, tone, and the movement lines all together. And if you do that, you get a better result.
Okay, so when you say do it all, is there a specific order that one should do all of these things in?
No, that's the thing. Each area independently does not affect the other. So can filler be done with Botox? Yes. Can Botox be done with a peel? Yes. Can Botox be done with a filler? Yes. Can filler be done with peels? Yes. You could basically do them all. It's just in each category of aging, there's different aggressiveness. There's different ways to start the approach. So when somebody comes in, they've never done anything, maybe they're doing filler and Botox on that day, and then they start with a facial and some skincare for their texture and getting them ready for a laser in a few weeks. And we get on that process where every quarter you're doing a bigger laser or peel. Every month you're doing a facial and a lighter peel, which is why I made my Aerify kit from emeragecosmetics.com. It's a kit you use every 2 weeks, a light micro peel, and you're doing that just to keep your skin turning over, get rid of sun damage. But every 3 to 4 months, you're doing a bigger peel or a bigger laser for that texture and preventative, or plasma pen for tightening during that time. You're doing your Botox every 3 months. You're doing your filler a couple times a year. And then you're doing your tightening procedures once a year. Things like thermogenol therapy for tightening of the tissue. Things like threads for lifting once a year, putting those in. So there's a full protocol that's set that I feel all aesthetic providers need to provide their clients. What I find from my clients, is they tell me they're not given that full treatment plan when they go to initial consults in most practices, and they're not followed up for that type of treatment plans. They don't even know those exist. If somebody comes into me, we're addressing all areas of aging at each age group and determining what they need. So I'll give you an example. I had a young guy, 62-year-old guy come in yesterday, never done anything before, a lot of skin sagging, a lot of sun damage, almost no facial contour. So we went through all of this. What did he do? He did his facial contouring with fillers yesterday. He did his Botox. So now we have his jawline, his cheek, his chin, his lips, his temples all filled. It looks really nice, much better volume for his age. Botox will set in and some of the wrinkles will subside because he'll stop moving. But he did a facial that day and took skincare home. So now he's starting his skincare process. In 2 months, we're going to do a big laser, and then he's going to do a facelift because he's 62. He needs that at this age. Once we do the facelift, we'll maintain his skin every 3 months with tightening procedures to protect his investment and keep his skin tight. This is the protocol that needs to be happening in a practice. You've got to do your initial immediate results and then start the long-term plan.
That is amazing for a 62-year-old man. Wow, he had a lot done in one day.
And he went to 3 doctors before, and they just told him to do his lips, and no one even offered him a facelift. And I said to him, I go, you're 62, your skin's all the way down here. I can't, if I'm going to keep using fillers on you, it's going to look unnatural. You need a facelift. What do you think? He's like, I'm willing to do that. And it was a man. A lot of people assume that men aren't going to want to do surgery or that they're not willing to take a more aggressive approach. But I think with me, because I'm very honest and I'm straightforward of what somebody needs for their age. And if he said, no, I would never do that, I'll tell him that I can never get the result that I would want, but I could make improvements that would make him look better, like starting the lasers and skincare, because remember, that can reduce the age by 10 years. I proved it on Access Hollywood, just that alone. Adding a little filler for contour yesterday, he was so happy. He had a jawline, popped his cheekbone out, temple filled, so he didn't look, like he was emaciated because he's very lean, being a runner. All of that just created that harmonious balance. And now he's going to Italy for 2 months for some trips. He says he's going to feel great, take amazing selfies. And then when he comes back, he's going to do his big surgery.
Oh, wow. Well, that's a wonderful testimonial there.
Exactly.
So why is the heart-shaped face so aesthetically appealing? And what injection techniques can providers use to achieve it?
That's a great question. I actually have an entire article online of how I kind of created the heart-shaped look. Everybody knows that as you age, the squareness or width of the face falls down. That's why as you age, you become from less of a heart and more of a upside down heart, or what we call a triangle. That is less attractive. People like to see the width much higher in the upper middle third, going down to a focal point of the chin that gives the face a more slender look, a more contoured look. And that's what has been deemed most attractive in many studies done on facial attractiveness. I do many lectures on this previously about how if you create that look in a male, you can feminize a male. And this is a feminine look. So in general, a heart-shaped look may be great for a female, but it may not be the perfect look for a male. But the concept of having the face lifted in a more youthful look, in a more youthful age, is very important. And so you always want to focus on trying to create that, lifting the area, volumizing the area, keeping the areas lifted. That's why, as you know, in the say past 10 years, most people were focused on the middle face. In the past 5 years, many people are focused now on the upper face, like brow lifting, the fox eye or the Cleopatra eye or the open eye look, because again, that even elevates the look even more. It makes the face look more lifted, more open, and more youthful. So you want to create that look. Now, how can you do that? Again, addressing each area of aging. Botox to stop movement lines can lift the brow when placed appropriately and open the eye. There's even an FDA-approved eye drop now called Upneek that we sell at our emeragecosmetics.com that you drop in the eye and it opens the eyelids, making you look more youthful every day. You could use threads to pull this area up and contour the cheek, making the middle third of the face lifted, and then fillers for contouring, not only just cheek, but temple, brow, all the way up into the forehead to lift the face and pull the face back. Same thing along the jaw to create more of a point when it comes to a female, or some squared off look for a male that gives them that more masculine sort of heart-shaped look.
Wow, great tips. Thank you so much.
No problem.
We are so excited to welcome you to Miami Beach this August for your much anticipated sessions at the South Beach Symposium. Among the topics you'll be covering, you'll also take part in the STAR panel expert-led discussion of practice management for cosmetic dermatologists. Why is it so important for dermatologists to come together in forums like this? And what can attendees learn from these interactions between the experts?
I think the most important thing is that there's collaboration in our industry, because there's so many people now, less experienced, that are doing treatments. I did a dermatology residency and fellowships that got me very knowledgeable on anatomy and the ability to do more complex surgical procedures like scar revisions and liposuction and things that a lot of people are just not trained in anymore. And if you're a new aesthetic provider, let's say a nurse, MP, or even a resident that didn't get a lot of experience, no fellowship, you really need to learn to be, to progress the field from those that are experts in the field and have experience. And so by going to panel meetings that are not related on just a discussion of a device, but about real world experiences, you're going to learn so much more. And there's going to be some hot debate, especially with me. I'm very controversial. Some people, I was written up as the cowboy of aesthetics in the West Coast on an article last year. So, I feel like when that is the case, there's going to be some heated debate, and not everybody's approach is the perfect approach. Sometimes the approach you need is based on your own techniques and goals, and also your patients. Some patient populations are a little bit different. Mine are a little more aggressive. Some people's are not. So I think working together and being collaborative, whether it's a heated debate or not, is going to really help progress the field and help younger, less experienced providers learn a lot more.
Okay, thank you for sharing that. Is there anything else you'd like to share with our audience today, Dr. Emer?
No, I'm very excited for us to be, for me to be joining SBS West Coast meets East Coast. It's going to be phenomenal. I really want you guys to join. I think what I'm going to bring to the table are complex combination procedures, things that you've never heard of or seen before, and with results-driven technologies and treatment combinations, and also the use significantly increased use of skincare to promote enhanced results. With energy-based devices, we'll be talking about newer, more progressive treatments like plasma pen and threading, and just overall, like really getting a good conversation going about how to be an excellent provider. So please join me at SBS West Coast meets East Coast. I'm really excited for this first ever meeting. I think it's going to be fantastic for all the providers.
Well, thank you. And we are beyond thrilled to have you.
Thank you
and
so much.
And thank you for all of your knowledge today as well.
It's going to be great.
Yes, absolutely.